Hi, my name is Ashlynn Anglin, and I'll be performing a respiratory focused assessment on my mother for my final checkoff. I first walk in and say, hello, my name is Ashlynn. I will be your nurse today. And then I ask her to confirm her name and date of birth while looking at her wristband.
Jennifer Anglin, 2873.
That was correct. So I say, I'm going to be performing a lung assessment, a respiratory assessment on you today. Is that okay?
Mm-hmm.
Then I can move on to her past medical history. Do you have any allergies?
Yes, sulfur drugs.
Do you have COPD?
No.
Do you have any shortness of breath?
No.
Do you have difficulty sleeping at all?
No.
Do you have any lung cancer?
Yes.
And do you have any infections
No.
currently?
No.
Now I can move on to her social history.
Mm-hmm.
Do you have any history of smoking?
No.
Do you drink alcohol? Do you exercise regularly? Occasionally?
Mm-hmm.
What does a regular diet look like for you?
Just regular diet.
And then I ask, what is your occupation?
Registered nurse.
What is your, do you have any exposure to irritants at all? Do you have your vaccines up to date?
Yes.
Like your TB?
Mm-hmm.
Do you have your flu vaccine?
No.
Pneumococcal vaccine? And have you had a recent chest x-ray?
Yes.
Now I can move on to her medications.
Mm-hmm.
Do you take any bronchodilators? Any Singulair? Antibiotics? Antihistamines?
Occasional Zyrtec.
Do you have any, do you ever take any anti-inflammatories?
Occasionally.
And corticosteroids?
No.
Now we can move on to the objective portion of the exam. So when I walk in, I will already observe her movements just by looking at her. And I can observe that there is a symmetric rise and fall of her chest. She is not in any awkward position, leaning down like in tripod. She is sitting upright and breathing through her nose and out of her nose. Now I can check her pulse ox, and while I'm doing that, I will also assess her respiratory rate. Okay. Her respiratory rate would be 15 and her pulse ox was 97. So both are within range. Then I would inspect her nails and her fingers and her face and lips as well for any discoloration. No clubbing showing deoxygenation. No, her fingers are warm and they're showing adequate blood flow. Her lips have lipstick, but they would also probably be pink. And then her skin is plump and she's not sweating and she's not breathing at an abnormal rate where she is pale. So she is within normal limits of what is supposed to be. Now I will look at her again. She is not using any accessory muscles, so that's good. Now I move on to palpation of her chest. I'm gonna feel around.
No crepitus.
The nurse in her is coming out saying she has no crepitus, but there is no abnormal things that I'm feeling on her chest. Now I will palpate for tactile fremitus. So if you could, when I say go, you can say 99.
99.
I can feel the vibration going down, so she tests good for tactile firmness. Now I will auscultate her lung sounds and voice sounds. So during this part, I will go across like this, well, under, and then down, and then down over here. That was a demonstration. Now I will go under her shirt and I will do the normal exam. Breathe in. Okay, so all of the sounds were pretty symmetric and normal. I didn't really hear any wheezing or bronchi or anything like that. Now I will listen for voice sounds. So first we'll test for ergophony. So whenever, I'll do the same motions, but this time I'll ask her to say E.
E. E. E. E. E. E. E. E.
Okay, everything's, she tested negative for ergophony, so that means that I heard an E sound rather than an A. Now I will listen for whispered pectoriloquy. So now you will whisper a short phrase like 1, 2, 3.
And
So she tested negative for whispered pectoriloquy. Now she will, we're going to do bronchophony. So you will say 99 as I move across.
99. 99. 99. 99. 99.
Okay, tested negative for that as well. It was muffled more. Okay, now I will percuss her lung fields to test for resonance. If there's any dullness, it's most likely a rib. But in a case where a patient has like pneumonia, there might be dullness in there because there's liquid. And in usual, a male or a female that has a little bit more breast tissue could be asked to lift their breast. And that's what would happen in a regular exam. Now we'll move on to the back. Okay. We'll do the same thing with the back, testing for the fall and rise. A normal fall and rise of her, the back part of her chest. I will do the same thing and palpate for any lumps, bumps, any tenderness, and there's none, right? No tenderness. Now I will test for the expansion. So I can do it like this on both sides. If you'll breathe in, breathe out, deep breath in, deep breath out, Deep breath in. Here you can kind of see how my hands were going out with her. I can also do the tactile fremitus on her the same way. So when I say 99, please say 99.
99, 99, 99, 99.
And I felt it up here. As when you get lower, it's not felt as much, but it was normal up here. Now I will test for the diaphragmatic excursion, and that will be with the tape measure. So at this, I will percuss her lung fields until I reach a point of dullness, right there. Then in a normal exam, when there is a bare back, I would take my little pen and I'd mark that area. And then I do the same on the other side. So it's about the same on both sides. And then she would let out that breath. And then breathe in a whole new breath. And breathe all the way out and hold it. So this is about where that one was. So about right there. And then I do the same on the other side, but I can test this length with centimeters. So it's about 4 centimeters. Oh wait, yes, about 4 centimeters. So that's pretty normal for that test. Now I will, since I can percuss the lung fields again, just to see where they start and end. Now I can auscultate her lung sounds. When you can, just take a deep breath in. I didn't hear anything abnormal, no wheezes, so her breathing was pretty normal. Now I will listen for her voice sounds. If you can, say 99.
99, 99.
Perfect. Can you say E?
E.
And can you whisper 1, 2, 3? Perfect. So there was, she tested negative for all 3 tests, and that was it for the respiratory assessment.